In this video today, we're going to talk about ultrasound guided injections versus blind injections of the joint, both the knee, the shoulder, and the hip. When we talk about ultrasound guided injections, it seems like it's a mainstay of treatment for most physicians that are in the know. But the fact of the matter is that's not the case. There are many injections, no matter whether the doctor comes from certain specialties, that really are reliant upon just doing an injection blindly with no image guidance whatsoever. And although intuitively we would think that that's probably not going to be all that great, many physicians feel like, I got this. This is not a problem. I always have good results. Why would I have to change what it is that I've always done? Some previous evaluations of clinical improvements for intra-articular injections have suggested that maybe blind is just as good. But when you actually look at it under X-ray, we can determine the accuracy of the injection isn't all that hot. So what we've seen is that there's several factors that can influence whether injection is going to be problematic from a blind approach. One is the size of the patient. Two is the severity of osteoarthritis. Three is the type of needle. Four is the expertise of the physician. Five is the tolerance of patients to pain. And all of these things make a difference. And so originally, one of the things that we saw was that the advantage of the procedure was that it was quick and fast if you did it blindly. And it was suspected that the failure rate was only about 4% in expert hands. However, in clinicians who are not expert, we found that failure rates blindly can actually be as high as 20%. So 1 out of 5. And in that context, do you really want to have an injection that has that degree of failure? And when we look at ultrasound guidance compared to blind procedures, 43% reduction in pain has been shown with the use of ultrasound guided procedures, in addition to improved efficacy as well as placement, both using a in-plane and out-of-plane technique. So meaning the needle being seen under ultrasound all the way through or seeing the needle tip. When we look at what the success rate is with an in-plane approach, the success rate is somewhere around 95% using ultrasound, and using blind technique as an average overall, the success rate is maybe somewhere around 78% across all comers. So if you have the advantage to be better, why not do better? For patients that have the option when they're evaluating their healthcare providers, this should be a conversation that you're having when you're looking at an injection type technique, whether it's a traditional steroid, a viscosupplementation, or even something like an orthobiologic like a PRP or stem cell type treatment. You should be evaluating your healthcare provider much as your healthcare provider is evaluating whether you're a good candidate for whatever the offering they might be proposing. If you found this video of help, please hit the like and subscribe button. And if you've had injections, both blind as well as using ultrasound guidance, please leave a comment below giving us insight about what was your experience. Thank you so much for your time and have a great day.